in addition to the webinars and the written materials that have been made available to you, we will also be developing a question and answer digest, and we'll be publishing that to you after the webinars are completed late next week so that you can reference that as well. And with that, I will turn it over to Siri.
Thank you, Miranda. Good afternoon, Carlina and Jody. It's just the two of you, so please do feel free to ask questions. Our purpose today is to go through with you the specifications for the intermediary metrics that are associated with your CBOSS change plan. And we also want to provide you with a live demo with Miranda to see how you're going to enter the data into Orca. I've been told I was quiet all day and I'm sitting right over the phone thingy. I will try to speak more directly into it. Sorry. Okay, next slide, Miranda.
And I also see that Carla Kane from Answers Counseling has just joined us as well. So welcome, Carla.
Thank you. Good afternoon.
Okay, so I want to start by providing a little bit of background about where these intermediary metrics came from. The OCH formed a committee called the Performance Measurement and Evaluation Committee. It was formed over last summer and met pretty intensively between August and November of last year. The goal of the committee, this is an ongoing committee, the goal of the committee is to provide recommendations to the board of directors related to data functions, assessment, monitoring, quality improvement, etc. And their first task, as I mentioned, between August and November was to design this set of intermediary metrics associated with the OCH change plan. And these metrics were derived from the 14 core measures that the OCH Funds Flow Work Group established associated with the core required elements of the change plans and aligned with multiple measure sets and in particular the Medicaid Transformation Project pay-for-performance reporting measures so that we can track through the intermediary metrics, we can track incremental change, we can track implementation progress over time and make sure that we're on the right track towards meeting those longer term measures in the pay-for-performance. So the 14 core measures are on your screen. They're separated into three sort of larger groups. The integration measures are mental health and substance use disorder treatment penetration, psychiatric hospital readmissions, and all-cause emergency department visits. Related to access, we have child and adolescent and adult access to primary care, as well as well-child visits for the babies and also for children 3, 4, 5, and 6, and access utilization of dental services. On the right side, the value-based contracting measures are what's referred to as the comprehensive diabetes slate, which includes 5 measures, controlling high blood pressure, statin therapy for patients with cardiovascular disease, chlamydia screening among young women, and the early combination 10 childhood immunization status for vaccination. So the task of the PMEC group was to look at those core measures and look at the elements within the change plan, the outcomes within the change plan, and figure out some intermediary or predictive measures that could help to guide the work of implementation and help let us know if things are on the right track. So those measures were developed and grouped into different metric subsets, and those are associated with the different change plan types. So your subset are the community-based organization and social services metrics that are aligned with your CBOSS change plan. So there are a couple of things that I just want to go through before we look at the specific measures themselves. Again, this is just reinforcing what I've already really said, but these really are aligned with the implementation of the change plan within the Medicaid transformation work. and that they are designed to align with and predict the movement towards the OCH core measures, many of which fall within the pay-for-performance measures, which the OCH is accountable to under the Medicaid Transformation Project and the Washington State Healthcare Authority. Part of their mechanism for paying and for the OCH to earn funds is through our performance on those pay-for-performance or P4P measures. So we intend that these measures will be used by organizations and by the OCH for learning and for quality improvement. And additionally, under development is a mechanism for distributing OCH bonus funds. So there are some funds in an additional account that are earned because of our high performance that will be available to partners based on several different elements, one of which is related to these quantitative metrics. And one note on that is that we're interested in performance or improvement over self. So we won't be comparing organizations, but we will be looking at organizational change and improvement over time. The measures within the quantitative or the intermediary metric set are to be reported twice a year for 2 different 6-month periods, January through June and July through December. And for the next, or this first reporting period, April, due in the middle of April, it is to cover the period July through December 2018. The data that we will be collecting are as close in alignment with the data for the Healthcare Authority measures and for the intent of the Medicaid transformation work. And in that case, we are asking for you to exclude duals from your reporting. Additionally, we have specifications that are related to age groups. Some of the measures you will see have specific specific age groupings. And when those are written that way, we'd like you to report based on the age groups. But if they are not labeled by age group, we ask that you report all ages. Additionally, for some measures, there are Medicaid enrollment requirements, the number of continuous months or other types of specifications. And when those exist in the definitions, we ask that you adhere to those. But if they are not listed, there are no minimum requirements, and we just ask that you report on everyone. There are some measures, I don't believe any of these apply to the CBOSS, but with national definition sets, some are called HEDIS or HEDIS modified or NQS, and we just ask that if you are able to, in reporting on any of those national standard definition types, we would ask that you do that consistently so that your biannual report over time is based on a consistent definition set. So the information that you'll be putting into ORCA might be just a single number, so just a numerator or a count of something, or it might be a numerator and a denominator, in which case ORCA will auto-calculate a percent or a rate. We have 2 special values that we would like you to use in 2 special cases. When you have a measure or a metric for which it is not applicable to your organization and will not be applicable to your organization, we ask that you enter 8888, and that will tell us on the back end that this measure is not something that you're reporting on and not something you plan to report on, in which case we'll work with you to make sure that we can remove that measure, or if it's something different, then we can work on figuring that out with you. And we would ask that you use a 9999 when there is a measure that you are that you will be reporting on, but you're currently not able to. You do not have data for some reason, you're not collecting it yet, or you just don't have data available. I'll pause for a moment. Are there any questions on the material that I've covered so far? Okay, so it will just take a couple of minutes to go through the specific metrics within the CBOSS metric set. And this was attached, not the slides, but the original metric set was attached to your calendar invite, in case you hadn't noticed that, but I will be walking through each of the metrics. There are 11 that are associated with your change plan. They fall in the categories of beneficiaries served, behavioral health, physical health, and social determinants of health. Beneficiaries served is a metric that is common across all metric sets, so all change plan implementation partners will be reporting on this. There are two elements to metrics. One is to document the number of unduplicated Medicaid beneficiaries served in the entire calendar year. So when you report this in your current reporting right now, due in the middle of April, we're asking that you report for the entire calendar year 2018. And the second metric, beneficiaries served current reporting period, would be those served in the second half of 2018. So the current reporting period at the top of that box would be July through December 2018. And I don't know if this is relevant to any of your organizations, but if you are not collecting Medicaid status, you're not collecting insurance type, this is an important metric for us in the Medicaid Transformation Project. So we'll need to work with you on figuring out a way that we can understand this information, if not capture it, but at least understand it. So if that relates to you, then go ahead and reach out to us and we'll work on talking through that with you. Jody has a question. What if we serve Medicaid recipients, but it's not related to any part of your change plan? I think we'll probably need to figure out, we'll need to talk to you specifically about that, Jody, to figure out what the service line is. So let's follow up with you on that specific question.
This is Carlina. Can you hear me?
Yes, thank you.
I have a question. So one of the things we're working on at the end of March is to do a specialized near sciences training for those in the food systems as part of the members of the OPHCC coalition, but also the Peninsula Food Coalition, specifically tailored toward food access and chronic disease prevention and how that intersects with near sciences. So this would be a group of leaders that we're doing this in-depth conversation and training with, and they serve many Medicaid beneficiaries. So would that be something that we'd just count, like the director of the SQUIM food bank, for example, or would we count the policies and changes that she implements because of this training to all of her Medicaid clients that she sees in her food bank? Does that make sense?
Yep, that's a really good example of a challenge. So
okay.
There is another measure later in the measure set that will capture your training participants. So this measure should be uniquely and specifically individual Medicaid beneficiaries, not individuals you train or you touch who serve those beneficiaries. So it could be that if your organization is, training the service providers, but not actually directly providing services or working with the beneficiaries themselves, that this could be a 0 for you, but your training number might be really high. Does that make sense?
Okay, so this is people that Medicaid users that we have direct contact with, and if we have indirect contact with them, then through directors and other community leaders, then that would be in a different category.
Yeah, we can touch on that when we get to the training
measure. Okay. Okay.
So within the CBOSS metrics, there are 3 metrics that capture your service areas, if you will. One of them is related to substance use related programs and education. So this would be individuals who are participating in programs that you may be delivering related to safe medicine return, opioid misuse, abuse, and storage, syringe exchange, chronic pain group, these come straight out of the change plan. And for this, we would be looking at a total count of individuals. So if someone participates in every single one of these, when you provide that service or that program, you would count them every time. So for some of you who are not providing services in these areas, then this would be an example of one that you would say 8888. This is not a service area that's applicable to my organization. This is a set of 4 measures that look at 2 access to physical health questions for 2 age groups. So adults ages 19 to 64 and youth under the age of 19. And the 2 types of questions we're looking at are, do you have a doctor or personal health care provider, a primary care or physical health provider? And if you do, have you seen that provider in the last 12 months? These are questions that may or may not be on a screening form or some kind of a review form that you may do with your with the individuals who you serve. But what we're trying to understand here is, among those you serve, Medicaid beneficiaries who you serve, are they engaged in within the physical health care system? And the third bullet there is a clarification that this is not something we would expect you to be asking of the people who you're training if they are, agency leadership or staff. This is really intended toward Medicaid beneficiaries, clients. This is another measure that captures individual participants in a service area, and in this case, it is chronic disease programs and education. So here we would be looking at the number of participants in chronic care services, asthma interventions, healthy eating, active living, or obesity-related work. And for this, we again would be asking you to count individuals for each program or educational service that they participate in. And coming back to your question, Carlina, this is not yet the training question. So I think that we would put your, I think that yours is going to go in the, I don't know if it's the next slide or the slide after, but let's, once we read that one, we can flip back if we need to. So this would be another bucket of work related to prenatal and early childhood program participation. And this would be those services, maternity support services, or preconception services, nurse-family partnership services, those things that are related to prenatal and early childhood. And for this, we are asking you to count both the adult or the parent caregiver and the child when that is appropriate, when they are both participating in the service. There's something funny about this slide. Can you get rid of the little box in the middle? Interesting. It's right in the middle. I don't know how I did that. There we go. Yay, Miranda. Okay. So this is the slide that captures metrics related to training. So here we would be asking you to provide the number of individuals participating in trainings that are associated with your change plan, the work that you do within your change plan. And you would be counting individuals multiple times depending on the number of trainings that they attended. and trainings provided on topics associated with your change plan. So the second metric would be the number of trainings that you did. The first would be the number of people who participated. And I just pasted out, there are 3 trainings that are within the that are labeled in the change plan, and I just pasted those 3 there as an example. So this, I think, Carlina, would be where you would probably be tracking your trainings, because I believe, if I understood you correctly, what you're doing is a training, not an educational program.
Correct. It'd be a training, yeah.
Okay. Those are the metrics within the CBOSS metric set. Are there any questions on any of those?
This is Carlina. I have a question again.
Sure.
So because this is the reporting period before we received any funding to support our reporting, is it expected that our numbers will be lower? Or, I mean, because we were doing work, but it wasn't funded, or maybe why?
You're referring to this as a baseline. So the
Okay.
intent is to get a sense of what things were like before.
So this is regardless of funding source for the organization, right? Or
Yes.
just, okay. Okay. So that's a little bit different in my head from other programs that I report on. So, okay.
And I would also just remind you that our intention with the reporting is not to compare organizations, but to look at individual organizations over time and allow you to look to track your reporting over time.
And there was another question in the chat box from Jody about if there are resources we can access to deliver trainings. And I think I need a little clarification, Jody, if you're able to provide it on what you were meaning by your question. Okay, so clarifying trainings around neurosciences, social equity, or health equity, LGBTQ, which are listed in the change plan. Yes, as a part of the site visits that we've completed and are just finishing up in the next 2 weeks or so, we are collecting feedback from our partners about what training resources might be helpful if OCH were to invest in bringing trainings into the region. And so those are things that we'll be looking into as the year progresses on to see if there's possibility and consensus among our providers about what would be valuable. And OCH will continue to pass along through the NCC distribution list any training opportunities that come up within the region as well. So as long as there are any other questions, I'm going to open up my web browser and do a quick demo in Orca to show you where you actually will be accessing completing this report. So hopefully Orca is familiar to most of you, and you've had some exposure being in there through doing the progress to date reporting. So you access your login at healthcarecommunities.org, and you'll log into your account. Once you log in, you will see the NCC that you are assigned to. So I believe some of you may have access to more than one NCC, depending on if you are providing services in more than one, but most of you will just have access to one. So for argument's sake, I'll go into Clallam. And before I continue on with the demo, I should have clarified, yesterday you received an updated calendar invite for today's webinar that includes the written instructions for completing the report in ORCA. So everything I'm about to go through is included in those written instructions that are in your calendar invite for your reference as well. So this is what we're referring to as the NCC homepage. Up here in the upper left corner is where the change plan link is. This is where you can access your saved version of your change plan and also where you completed the progress to date report. Here you'll see there is a change plan tab, and this is where you could select your organization, and your change plan would be accessible there, as well as the progress to date report. This tab here that says intermediary metrics reporting is new. What I am accessing right now is my test account, so it is the user version. So everything that I am showing you is what you will see when you log into ORCA yourself. So to complete the intermediary metrics reporting, you will navigate to that tab. You'll receive this welcome message, welcome to ORCA intermediary metrics reporting section, and it will have my contact information listed. The tab here to the change plan will be accessible if you need to quickly navigate back to your saved change plan or your progress to date report. But to do the intermediary metrics reporting, we'll go here to the reporting drop-down menu, select enter data. And here is where you will see your organization. You will only see the organization that you are assigned to, but I have given my test account access to a couple of different ones, but for argument's sake, I will go here to the test CBOSS organization. And on this page, you will only see those measures that are assigned to a CBOSS change plan type. Right now, all CBOSS partners are assigned the same measures. After this baseline reporting period, as you are potentially entering this 888 code to indicate this is not applicable to you, is when this measure set will become more personalized based on your specific organization. You'll want to confirm that you're in the correct reporting period, which is July through December of 2018. Right now, it is the only reporting period that you're able to select. You will then, in the white cells, put your data. I've already entered a couple of test data here, but for argument's sake, I can enter some data. Let's say this is an instance where I don't think this is applicable to my organization type, so I'm putting in the 8888. And maybe this is something that is applicable, but I'm not able to report on it, and this is where I'm putting in the 9999. This is an example of the numerator denominator that is calculating a percent, so I can just enter some made up dummy data here. And I don't need to fill all of this out for you, but down at the bottom here or at the top of the page, you'll see a blue Save Data button. You will click that button once all of the cells are completed. Please don't leave any cells blank. Use the 9999 or 8888 to fill in any not applicable items, but a blank field will indicate an incomplete report. Once you hit the Save Data button, you'll see that the button now has turned gray. Also, where you have entered all of this count and numerator denominator fields in the white cells will then populate into the gray cells for you. So that's the other way you can confirm. So here you'll see this 4 out of 4 is now calculating at 100%. This count here, 9999, where I'm saying it's not applicable, has now counted here into the gray box. You will also get a blue text field up here that says data saved, reporting date, July 1, 2018. The reporting date is auto-populated to the beginning of the current reporting period that you are reporting on. So that's why it's July 1. But the blue text field is also your way to confirm that your report has been saved in ORCA. And that is it in terms of completing the reporting in ORCA. A couple of questions that we received earlier today were around if you could save your data and come back to it. Yes, you absolutely can. OCH will not be coming in to ORCA to check on the reports until after the April 12th deadline. So it's just very important that there are no blanks after the April 12th deadline, because that will indicate to us that it's an incomplete report. So you are able to save and log out, come back in, save if you need to work on this in more than one session. Also, if you have more than one person who might be accessing this report, everyone who is currently assigned to your change plan is also currently assigned to be able to access the intermediary metrics reporting. The only caution that I would have for you is not to have multiple users entering data at the same time, because I'm not quite sure what the capabilities of the platform are in terms of live updating that information. But if one user went in and did part of the report, saved what they were working on, and then subsequently another user went in, there would be no problems with that, because the data is saved to the organization, not to the user. Are there any questions about ORCA or completing this in ORCA? Okay, as always, if you run into any issues with ORCA, please just let me know, and I am more than happy to help troubleshoot and problem solve. So please, you're more than welcome to call or email me. I believe all of you have my contact information. This is just a reminder that the baseline is due April 12th, 2019, and this is what our reporting looks like moving forward. You also received this at the NCC convening in the deliverables calendar. And if you haven't had your site visit yet, you'll also receive a copy of that calendar during your site visit. So moving forward, the next steps are I will be sending out copies of today's slides later this afternoon or tomorrow morning for you to have as you work through ORCA. You also have those written instructions for completing the report in ORCA attached to the calendar invite, as well as the PDF of all of the metrics are attached to the calendar invite as well. As we finish our next 2 days of webinars, which are Friday and next Tuesday, we will be compiling a question and answer file and releasing that out to all of our partners as well, so that you can reference back to that for any questions that you might have that you asked today that were not answered, or that might come up as well. If you need to contact us in regards to questions about specific metrics, the best way to do that would be to email myself and Siri together so that we can tag team your questions and answer them in the most timely manner. Before we end, I just, what we've been doing in all of our webinars today, because you are our 5th one today, but our first CBOSS webinar, is just to do a quick temperature check and get any feedback about, was the webinar helpful to you? And also, how are you each feeling about reporting on the metrics moving forward?
Hi, this is Jody. Can you hear me?
Yes, we can hear you, Jody.
I think this was very helpful. I'm still terribly confused because about how our metrics will look, because we have such indirect contact with Medicaid clients. We organize the services, but we often don't deliver them. So it's my challenge.
Thank you. Thank you for sharing that, Jody. And I don't think you're the only organization who's experiencing that confusion. I think that particularly with our community-based organization partners, some of these things don't fit quite right, and so we're still learning and exploring that process, and we really would like your feedback as you move through this process, and if you have questions or taking notes on your experience, because we're really committed to making this be helpful to not just OCH, but to you as well, and we recognize that some of these metrics can be a challenge for some of our partners in the unique work that you're doing.
This is Carlina. Once again, thinking about baseline reporting of the last 6 months of 2018, and the strength of our work in that we are a coalition, right, is that it trickles through, it has tremendous reach, what we do, but like Jody said, it's an OPHCC staff person, because there's one or half a staff person of OPHCC right now, isn't always the person making the impact. It's through our coalition and network and training and skill building that these big impacts happen. And so just thinking of how to report that, like the impact of the coalition can be quite daunting to report on.
I appreciate both of your comments, and I think that the community-based organization and social service partners really, your role very much is that training and really those sort of fundamental supports. And no, you're right. In a lot of ways, your reporting won't show the changes in health outcomes, but it is through your work. So we are aware of that. This is one piece of reporting. Remember that you have there are 4 elements of your reporting. You have your site visits, the progress to date on the outcomes in your change plan, and your narrative reporting within your change plan. So please know that this piece of the reporting is just one element, and the PMAC committee and also our work together with the managed care organizations and through the clinical community partnerships work, there's a lot of interest and emphasis on figuring out how we strengthen our partnerships and how we strengthen our social determinants tracking. So think of this as just one small piece of the bigger puzzle.
Great, thanks.
Well, if there are no other questions, then we can adjourn, and hopefully you each can step outside for at least a few minutes and enjoy the beautiful sunshine while we have it. And we really just thank you for your time and attention during our webinar today. And if you have any questions, please just let us know, and we're here to help.
Thank you.
Thanks for joining us.